Welcome to the inaugural Mental Health Sustainability Programme event. I wish we could be together right now, but alas, I'm beaming to you virtually. But I do hope we get an opportunity to meet together in the future. On behalf of the programme team at the Association of Mental Health Providers and the governing body, we are delighted to welcome you here today. I'm Sonia Trivedi, Executive Director of Income at Samaritans, and I'm delighted to be part of this programme. All of you being here with us today means so much to us. So we're joined by our generous donors and private sector partners, the Coalition of Mental Health Charities behind the programme, the provider organisations who have been beneficiaries in the pilot phase, and also many people and organisations who have expressed an interest in the programme. So the agenda for our session: hereafter the event will be compared by Dania Haves, Project Coordinator at the Association. Dania Hanif, Head of Programmes and Policy at the Association, will provide a programme overview. Hayley Alton, Community Engagement Officer at the Association, will talk to us about the pilot phase. Then our inspiring providers will be introduced by Maria, Director of Muslim Youth Helpline, with updates from Anxiety UK, Mashriq Challenge Resource Centre and Mum's Aid. There have been many of you who have been by our side in this journey, including our wonderful private sector partners. Anna Russell, Corporate Responsibility and Sustainability Director at Bupa, will begin, followed by more amazing donors: Richard Node, CEO of Goldman Sachs International, and Charlie Jacobs, Senior Partner and Chairman of Linklaters. Next steps will be shared by Caitlin McPhee, Project Lead at the Association. And then reflections will come from Poppy Jamin, Coalition Member and CEO of the City Mental Health Alliance. Finally, Kathy Roberts, Chief Executive of the Association, will close our session. So as is customary with any webinar like this, please do use the chat function and the association team will be on hand to answer any of your questions. Of course, if there is anything that requires a bit more detailed response, the team will get back to you post the event. So it now gives me very great pleasure to introduce you to Dania, who will give an overview of the programme.
Hello everyone, I'm Dania Hanif and I'm the Head of Policy and Programmes at the Association of Mental Health Providers. We're the only national representative organisation for voluntary and community sector providers of mental health and wellbeing services, working with local, regional and national organisations across England and Wales. In the last 8-9 months, the VCSE mental health sector has continued to face many challenges in delivering services. This has been intensified by the lockdowns and the varying tier systems. And it is so vital that service providers working in the community are supported so they can continue delivering essential, life-saving services to people who need it most. In the first few weeks of the pandemic, some VCSE providers experienced an unprecedented rise in demand for their services, especially those providing diagnosis-specific or culturally appropriate helplines, such as Anxiety UK and Muslim Youth Helpline, who you will hear from a little later on. This increase in demand has continued over the months, and we know that people's mental health will continue to worsen, and the sector needs to be there in the community to offer support. Services were already stretched and struggling with both pre-existing and COVID-19 related challenges in funding, resources, capacity, and workforce, but the pandemic has only further exacerbated these. And since March, providers have lost critical sources of income, with many relying on cafes, shops, face-to-face fundraising, events, and other trading activities to raise vital funds to deliver services. And beyond funding, organizations had to adapt swiftly to change their delivery model from face-to-face and instead offer support digitally and via the telephone. But despite these challenges over the last 8-9 months, The VCSE sector has demonstrated that it will do whatever it can to continue providing services to its service users during this time, especially as they continue to see a rise in the need for some services as a result of the pandemic. But the VCSE mental health sector needs our support to be effective and sustainable, and to remain in a position to support people with mental health needs, the local communities, and our NHS partners during and after the pandemic. We need to address the long-term sustainability of the VCSE mental health sector, especially at a time when these services are and will continue to be most needed. VCSE provider organisations are the ones that are best placed to support those communities that are being most impacted by COVID-19, whether they're from the racially minoritized communities, children and young people, those that are homeless, those who've been in contact with the criminal justice system, or those that are victims of domestic violence. We know that the VCSE mental health sector is the largest form of community-based mental health service provision, and for us at the association, as the representative organisation for this sector, the question remains, who will be there to offer this support to communities if the VCSE sector no longer exists? And this is why we've worked collaboratively with the 15 other leading mental health charities and social enterprises, as well as the private sector, to establish the Mental Health Sustainability Programme, where we're able to offer the small and medium-sized organisations working with and led by these communities our support at this time. In the last 7 months since the launch of the programme, we have aimed to raise money and minutes to support and help sustain and grow the VCSE providers doing critical work. With a focus on health inequalities that exist, which have been brought to the fore as a result of the pandemic, the programme will support VCSE organisations providing services to communities disproportionately impacted by COVID-19. We recognise the needs of the mental health sector, and so the programme, with support from our private sector partners, will help develop the capacity and capabilities of organisations to support individuals and communities. We are so grateful to the companies that supported the launch of this programme with their time, skills, knowledge, expertise, and funding. Multi-sector collaboration is key as we move forward to ensure both money and minutes reach the vital community services delivering support at this time. The values at the core of our organisation and the programme are based on trust, collaboration, empathy, respect, and equality. And through this programme, we strive to live up to these. Since the launch, we're pleased to have initiated the pilot phase of the programme, which you'll hear more about soon. And in the last few weeks, we've also put in place a small grants fund, a learning programme, and a resource hub. Every day, we're taking strides in delivering the support programme, but there is still so much more for us to do. Our goal from the start was to work with UK businesses to raise at least £5 million and secure 1 million minutes of volunteering. And we hope that after today's event and hearing from some of the speakers that will follow, you will be able to join this innovative, collaborative programme and help us to help those that need it most. Thank you.
Thank you, Dania, for setting the scene and explaining the aims and values of the programme. Please now allow me to introduce Hayley Alton, the Programme Community Engagement Officer, who many of you, especially the providers, may have already had the pleasure of meeting. Hayley's going to update us on the programme's pilot phase and talk about the private sector partners and providers who have participated.
Hi, I'm Hayley. I joined the association in September, working with the team to make the programme what it is today. Primarily, I'm taking the lead on supporting our providers to understand what their needs are presently. We're then taking that information to make the programme as accessible and relevant as it can be to them and to other similar VCSE organisations in the mental health sector as we open up for new applications. On the screen, you can see the names of the 9 provider organisations in the pilot. They vary in size, operational region and beneficiary group, with some supporting diagnosis-specific and others face-based. All organisations, however, are representative of those who have been disproportionately impacted by COVID-19. Recurrent themes of support when we speak to these organisations are that they need help measuring their impact and success through the pandemic, conveying that and other operational elements into a strong and successful fundraising bid, marketing their services and organisation in a strategic way, especially where they've delivered new services in response to this pandemic, implementing appropriate digital systems that complement the skills of their workforce, and various legal issues such as managing home working and GDPR compliantly. In addition to the support in these areas, they're of course looking for funds to continue the work that they're doing. That's where our private sector partners come in. We've received support from each of them in a different way. Mostly they've enabled us at the association to set up the engine room of the programme in a way that we see fit in response to our conversations with providers. But they've also supported so many more ways than just providing funding or minuted volunteering, but by sharing resources to create a learning portal for our provider organisations and helping us establish a grant giving fund so that we can support these organisations flexibly in a variety of different ways. We're also in a matched funded partnership with South West Yorkshire NHS charity Creative Minds. They're focusing on reaching individuals and groups and communities who can inform the programme of services that they need in their area. Creative Minds have recruited project workers and community reporters to complete outreach that will inform what these local communities need and ensure that it is locally led. If successful, we're hoping to roll this out where we can find other partnership organisations in the geographical region that we are administering the programme.
Thank you so much, Hayley, for sharing those highlights from the pilot phase. We really wanted to bring to life the experiences of the providers on the ground during the pandemic. And so I'm thrilled to introduce Maria from Muslim Youth Helpline, who will introduce a short film we've put together incorporating clips from 3 other providers in our pilot phase: Mums Aid, Mashreq Challenge Resource Centre and Anxiety UK. We hope that this will go some way to showing you what life has been like for the voluntary community sector during these unprecedented times and demonstrate why the success of the programme is so important.
Hi, I'm Maria Mahmood from the Muslim Youth Helpline. We've all had a tough year to say the least, and whilst news of the vaccine and easing of lockdowns are beginning, a less apparent, however more grave result of the lockdown is still around, and its impact affecting some for years to come. The mental health and well-being for majority has been impacted most recently, and those who were already seeking help and support were left with limited resources and coping mechanisms during the toughest periods. At Muslim Youth Helpline, we've had a unique year. Our helpline saw an increase of traffic by 313%. Our beneficiaries, young, Muslim, from BME backgrounds, were most in distress. They were managing COVID, bereavement, isolation, addiction, family issues, school and exam concerns. With an increase in traffic into the helpline and limited change to our resources, we've experienced more missed calls, and the calls we are receiving are from very distressed young people. We've dealt with more calls around suicide than ever before. Our staff have also been personally impacted by COVID and have felt loss. We've brought back volunteers onto the helpline to support our staff. We've had to retrain our staff on handling bereavement calls. We've ensured the well-being of our staff also remains top priority. Through MHSP, Muslim Youth Helpline have been matched with PwC, and so far we've felt well supported by their team. They are willing to elevate our cause to ensure we are putting in place strong buffers so that we're less impacted by future shocks. We're excited to see where this partnership goes. We'll be hearing from our other providers, from Dave and Niam from Anxiety UK, from Salma from Mashreq Challenge Resource Centre and Jane at Mums Aid on how they are coping during the pandemic. You'll hear how organisations became frontline workers overnight. While some organisations took a pause during the initial lockdown, our services have had to pick up speed, move our services to our homes, seen increased traffic to our helplines and services, and had to remain available to the people we serve. Each provider today has shown strength and adaptability, has shown courage for our service users and passion for the cause that they serve. Thank you to everyone at Mental Health Sustainability Programme for supporting all frontline staff and organisations during this turbulent time.
almost 8 years now, since January 2013.
Hi, I'm Neve Shepherd. I'm the Partnerships and Helpline Coordinator, and I started in this role on the 16th of March this year, which was just one day before we all started working from home.
Hi, my name's Jane and I work at Mumsaid, a charity based in the Greenwich Borough, South East London.
Hi, I'm Salma Lokat. I'm the founder member of Mashriq Challenge Resource Centre. We provide mental health services specifically for South Asian women based in Birmingham.
So Anxiety UK is a national registered charity. We were formed in 1970 by Catherine and Howard Fisher, who set the charity up for those affected by anxiety, stress and anxiety-based depression. Since then, we've become a nationwide organisation, but we still have the same basic aims. As you may have already worked out, this year is our 50th anniversary. And despite the obvious challenges, we have been able to celebrate that achievement, albeit not quite as we had originally planned.
At Mumsaid, we provide support for mums in the perinatal period, so that's all of pregnancy and those with children up to the age of 2. We provide 12 weeks of specialised counselling in children's centres and community spaces across the borough. And for all those that live within the Greenwich Borough, this is completely free. If you're outside of the Greenwich Borough, we have a low-cost service, and we also have a private counselling service and couples counselling as well. We also run a service called Young Mumsaid. This service is focused mainly on mums aged between 16 and 21. We have this as a specialised service because our young mums' needs are often more complex. The support they need before they enter into our counselling services is often practical.
Most of our women lives in a very deprived area of Birmingham. Our service is unique in that we understand the needs of South Asian elderly women, as we are familiar with not only the language barrier that exists, but also have an understanding of the cultural diversities.
Our usual day today, prior to the first lockdown, would see the small staff team supported by a team of around 20 to 30 volunteers each week, 2 or 3 per shift, who would help answer the calls, the emails, the live chat and text messages each day between 9:30 and 5:30.
But since the onset of COVID-19, we've had to do things a little bit differently, haven't we? Just as the staff are working from home, our helpline volunteers are taking calls, answering emails, live chats and texts from home too. As you can imagine, the volume of traffic to our services has also increased massively during the pandemic. To give you an idea, in 2019, we typically see around 200 calls a week to our helpline, whereas during the peak of the pandemic, we saw over 900 calls in 1 week. This, of course, has had an impact on the organisation, particularly our overheads, such as the cost of running the helpline. We pay a certain amount per minute, so with this increase in volume, there has also been a huge financial effect for us. I spoke to someone on the helpline who told me about how they'd been away alone for 4 months after having lost their job and moved to a new area, not near any friends or family. The start of the new life in the countryside for this person was so marred by the loneliness and depression that she felt at the start of lockdown. But talking to Anxiety UK made her feel like she wasn't alone, and for every negative thought there can be a positive alternative that's just as easily exists.
When the pandemic hit back in March, we moved very swiftly and got all of our counselling sessions online, and we're very proud to say that we had no break in service. We rang all of our clients directly, spoke to them about this new arrangement, but as we weren't able to meet face to face. Some of those clients were hugely grateful that they could continue with their counselling journey and carried on via Zoom or telephone. Other clients have asked to pause some of their sessions. This was because doing counselling at home just wasn't viable. Either they didn't have the privacy, the space, or they had school children at home that they needed to homeschool and they couldn't really focus on their counselling. With those mothers in particular, we checked in on them every 2 to 3 weeks to see how they were getting on, to make sure that they were supported and felt happy, signposted them to other services if they needed it. We also ran several online groups. We had a journaling Facebook group which focused on art and mindfulness, and we also had a singing group on Facebook. We had a wellbeing group, Journey Through Motherhood, and also an art group. The art group's been very successful, and we've run 5 different groups across the course of the lockdown period. These groups were key. They also held people on our waiting list who were waiting to be seen. These groups were a useful tool to make sure that we kept those people engaged with our service until a free space became available with a counsellor. As a charity, throughout the pandemic, we've become very, very much in demand. We've gone from seeing roughly 10 to 15 mums a week to approximately 40 to 45 mums a week.
Due to the current situation, as face-to-face support mechanism has been suspended, and we have adopted our services using various resources, using digital and non-digital resources to connect our women via Skype, video calls, text messages, WhatsApp call. Unfortunately, these women are not highly educated and not aware of how to connect with this new technology, not only even having the knowledge, even though they don't have the resources how to access their services. It has been an incredibly tough time for those women who have not had been able to go out from their house. Not seeing people they care about, not even pop to the local shops to do the necessities. Some women who are not able to cook for themselves, so we also provide hot meals to those women who are in need. Some women also don't able to go out for shopping due to their long-term health condition, so we providing essential shopping to them. We also provided our contact numbers to all our vulnerable women in case of any emergency, they can contact us. We reassure them we are always be there for them to offer the support and help as much as we can.
Over the last few months, we've launched compassion-focused therapy, weekly facilitated online support groups. We've also got anxiety management courses that are delivered once a week for 6 weeks, led by an Anxiety UK approved therapist, and a new initiative called Calm Club, which allows subscribers to attend regular 30-minute hypnotherapy-based relaxation sessions, help manage their anxiety. These are just to name a few. We've also identified 2 other areas of our service development that we're looking for help and support with, and we put forward this project.
So the first of those is what we're calling initially a working title at the moment is our Calm Zone. It's a kind of a virtual sanctuary. We're still working on a final name for that, but it's a section, an area of our website that we want to be able to develop and have available for people during the nighttime. Our data analysis shows that our website is often at the busiest times of day are between midnight and 3 o'clock in the morning, when very few services are available to people. Obviously, our helpline's not open, the services are very few and far between. Another problem that affects many providers of psychological talking therapy services, including ourselves here at Anxiety UK, is one that ensuring that clients are triaged and connected with the most appropriate and efficacious form of therapy for their particular needs. Currently, this process is a manual one, is not particularly scientific, save for checking against an inclusion and exclusion criteria. And we're looking at the possibility of developing an artificial intelligence-based algorithm that could then go onto our website, could help people to select the most appropriate form of talking therapy that is suited to their needs, their symptomology and their personality. As a result of that, we've been connected already with Bupa's Director of Corporate Responsibility and Sustainability. And while these projects are still very much in their early days, we've had 2 very productive meetings to date, exploring how they could help us with these 2 initiatives. It's been really productive to talk through our ideas and our plans with others outside of our own immediate business, and to hear how an external audience perceives the benefits and wisdom of our thoughts, whilst also suggesting avenues to consider that we may not have considered or identified ourselves. Combining the knowledge and expertise of both the third sector and the corporate world is a great opportunity for all parties to learn from each other, and whilst delivering an outcome, hopefully, that will undoubtedly be enhanced by the combined efforts of both teams, and something that will, the support will make a real difference to the many thousands of individuals who turn to Anxiety UK for support.
During the pandemic, we applied for emergency COVID funding, and this meant that we were able to supply some of our young mums with data bundles for their phones so that they could carry on talking to their counsellors either on the phone or via Zoom, emergency nappies, baby supplies. We did baby bundles and things with a charity that's local to us called Mama Kind. And it was great to be able to support these mums and help them stay connected as well, because they were particularly isolated. I think during the pandemic, our mothers struggled particularly because when you have a new baby, you often have a support network around you of friends and family and things like that. And obviously in April, you weren't allowed to see anybody, go out and meet anybody or do anything like that. So the counselling for some of our mums was a real lifeline, as were some of our online groups. We're in a period of growth, so we applied to the AMHP for some specific support and areas of, we were looking for certain areas where we didn't have the expertise or the skills to make the next move. So we were successful in our grant and we have been partnered with PwC. And although we are early on in our relationship with PwC, we are starting to see the benefits of working with them. So we've launched a fundraising campaign for December. We are updating some of our communications that we send out to stakeholders and partners. And also, very usefully and quite important to us, is we are growing our network through their networks. They're promoting us in work, using us in policies, those kind of things as well. And it's that sort of practical help and raising awareness that we find very beneficial, as well as the skills and expertise that they are lending us at this time.
We are delighted to be supported by Mental Health Sustainability Program delivered by the Association of the Mental Health Provider. During this difficult time, their team was a great support to our organization. Through their support, BUPA also donated 4 laptops to our organization. These 4 laptops has been delivered to those vulnerable women who were very keen and shown interest to learn new skills, which they can directly connect with us.
We are Anxiety UK. We're delighted to be supported by the Mental Health Sustainability Programme,
delivered by the Association of Mental Health Providers.
My name is Jane. I work with Mumsaid, and we are delighted to be working with the Mental Health Sustainability Programme, which is facilitated by the AMHP.
I am a part of Mashriq Challenge Resource Centre, and we are delighted to be supported by the Mental Health Sustainability Programme delivered by the Association of Mental Health Providers.
I am part of Muslim Youth Helpline, and we are delighted to be supported by the Mental Health Sustainability Programme delivered by the Association of Mental Health Providers.
We are so grateful that these incredible organisations have taken the time from their extremely busy schedules to give us a glimpse of what it's been like for them during these challenging times. And the very fact that they have only further reinforces the value that this programme has in supporting and sustaining them through the pandemic. Thank you to all of you. I now have the pleasure of introducing you to Anna Russell, Corporate Responsibility and Sustainability Director from BUPA, one of our valued private sector partners who has supported both us, the association, and providers in our pilot during the programme. Anna, over to you.
Hi everyone, I'm Anna Russell. I'm the director of the BUPA Foundation, and it has been our huge privilege to be one of the founding supporters of the Mental Health Sustainability Programme. So we got involved right at the start, supporting the programme with its overall brand values, but also the identity for the programme as well. And a big thank you to our brand team who have been involved in making that happen. We've also been supporting in other ways too, so supporting the partner charities that the programme is involved with. And just to share a couple of highlights. So we've been working with Kids Inspire, supporting them with their website copy for their new website. We're also working with Anxiety UK, who are based around the corner from us, up in Salford, with some of the work that they're doing, so helping them shape a new part of their website, but also how they take some of their projects to their kind of the corporate partners that they work with as well. And obviously there are huge benefits to the partners that we support, but also huge benefits to us as well. And we're deeply passionate about making sure that we put something back into the communities where we both live and work. We're also really passionate about making sure we share our expertise in mental well-being, and this is a wonderful way to do that. And I would encourage any organisation to support where you can, when you can, because you'll get so much from it. So thank you for listening and enjoy the rest of the event. Take care.
Our heartfelt thanks to Anna and the team at Bupa, without whom we would not have been able to complete the programme's branding and get the pilot underway. Thank you once again. I'm now delighted to be introducing representatives of two of our very generous private sector donors, Richard Nodder, the CEO of Goldman Sachs International, and Charlie Jacobs, Senior Partner and Chairman of Linklaters. Without their incredibly generous contributions, none of this would have been possible. Now, without further ado, on to Richard and Charlie.
Well, hello to everybody. I'm Richard Nodder. I'm CEO of Goldman Sachs International. And it really is great to be part of this update and to share why this initiative is so important and why we chose to be a founding supporter and funding partner of the Mental Health Sustainability Fund. Earlier this year, we funded $500,000 from Goldman Sachs Gives to seed this initiative, and I'm delighted to see the progress to date. Right from the start, the business case and the purpose of the Mental Health Sustainability Fund has been very, very clear to us. The COVID pandemic has created unprecedented challenges for all of our people in all of our organizations, particularly for the delivery and funding of community and charity-based mental health services. And these are the services that many people rely on for advice, for advocacy, and often for really life-changing support. And so the role of these services in society is more important than ever right now, and it is vital that we work together to secure their future. What drew us to this work initially was the opportunity to join a coalition to bring together and to create sustainability through bringing expertise and partnerships in a new and unique way to the benefit of those in need. And key in the design for us was to ensure that Black and minority ethnic people would be supported and directly benefit from the program. Data shows that these groups of people are disproportionately impacted by the pandemic and have unique and often negative and challenging experiences of mental health stigma and treatment. Smaller charities and community-based organizations have demonstrated their ability to reach these diverse communities effectively, and we are keen to help them as they carry out their critical work. Mental health leadership has long been a key priority for myself and for all of us at Goldman Sachs, both in terms of supporting our own people through programs like Mental Health First Aiders and in our philanthropic work across the UK more broadly. Indeed, our involvement with the Mental Health Sustainability Fund builds on our Mentally Healthy Universities program that we launched in partnership with Mind in 2019. Mentally Healthy Universities provides mental resilience support and specialist training to staff and to students with the aim of creating holistic change across higher education and broadening the discussion around mental health. Like the Mentally Healthy Universities program, the Mental Health Sustainability Fund aims to provide support across the sector, growing the capacity of organizations and helping them foster innovative and new programming. In both our work with Mind and the Mental Health Sustainability Fund, we are extremely proud to be part of a wider coalition working to facilitate systemic change. Mental health is a key issue for us all, and it is imperative that organizations of every size play their part in moving this conversation forward. So let me end by thanking everybody who's involved, and especially to the City Mental Health Alliance for connecting corporate partners to this opportunity, and the Association of Mental Health Providers for their bold leadership. There is much more work to do, and we are proud to be standing alongside all of you to lead, to collaborate, and to create sustainable growth in this critical area. Thank you.
I'm Charlie Jacobs, the Linklaters Senior Partner and Chairman, and I'd like to just tell you a little bit about why I was so comfortable in Linklaters supporting Poppy's request for Linklaters to support the MHSP. Throughout the COVID crisis, we've realized there are a lot of charities that are really suffering. And quite early on in the pandemic, we decided that we would allocate £1 million and 10,000 hours of Linklaters lawyers and pro bono time to help charities. And over this period, we've assisted over 50 charities. So when Poppy said, how about money and time and helping on this, it just dovetailed beautifully with what we were doing already, but actually articulated in a way that Poppy normally does, which is even better than we had. And we thought, well, actually, yeah, we have got some money we can put in, and we have got some hours we can put in. So we think it's a terrific program. In fact, we liked it so much, and one of our commitments on the time was we seconded one of our qualifying lawyers, Caitlin, to the organisation to help drive this program forward. So I hope, like us, you'll get involved as well, and let's continue to make a difference at this difficult time for so many people. Thank you.
Some powerful words there. Thank you. And thank you to all of our donors thus far who've enabled us to get this program off the ground. So, you've heard from many people about where we are today and how we got here, but where are we headed to next? Please let me introduce you to Caitlin McPhee, our project lead and secondee from Linklaters, who will tell you about our plans for expansion and the next steps.
I'm Caitlin, and I joined the programme at the same time as Hayley back in September this year. And as Dania mentioned, I'm the project lead for the programme and have been really focusing on just getting everything to a place where the programme itself can run efficiently. That's covered everything from drafting documents to negotiating agreements with our partners to communications and reporting. It's really quite a broad role, but thoroughly enjoyable, and I'm really looking forward to telling you where the programme is going next. Thank you to everybody who shared so far. As you can see, we've come quite a long way since the programme was launched in June this year. In August, we launched the pilot phase, and that is still ongoing. But in October, we were really focusing on our expansion plans for the programme. And that's what we've really been focusing our work on as a team over the last few months. In November, we put out an invitation to tender for the role of research and development partner for the programme. That partner has now been chosen, and we're currently in the process of setting up the evaluation framework, which will really help us to measure the impact of this programme over the next months and hopefully years. So here we are in December, and we're in the middle of our virtual event, the first one, hopefully of many. And we're at an exciting point in the programme. As well as trying to expand the number of volunteering minutes that we have available and the number of providers in our programme, we're also launching a grants fund, which comprises a pot of £200,000, which we are currently advertising as being available to providers who can demonstrate that small grants would really help them to increase and continue their sustainability over the next few months through the difficult winter period of the pandemic. In February next year, we'll be launching the focused projects with our community partner in South Yorkshire, Creative Minds. These projects are really going to be to support the BAME community in South Yorkshire. And as Hayley spoke about briefly earlier, we are lucky enough to have secured matched funding for the grants that we have given to Creative Minds. And then really for the rest of next year, we'll be focusing on increasing the number of providers that we're able to support through this programme, with a target of supporting around 100 providers by August next year, hopefully more. So we're really looking forward to seeing how we can collaborate further with the private sector to reach the maximum number of providers that we can.
Thank you, Caitlin. Exciting times ahead. I think everyone can agree. Before we close, one of our valued coalition partners wanted to say a few words about the progress of the programme to date. Having been so heavily involved in the programme's inception, please allow me to welcome Poppy Jaman, CEO of City Mental Health Alliance.
Thank you very much for inviting me to say a few words. Look, I haven't been involved for a number of months now, so the first thing I want to say is a huge heartfelt thank you to Kathy and Nigel's leadership for making this into what we have just seen today that it is. What an amazing achievement and program. Back in June, I remember reading something which said that 40% of SMEs charities were going to not exist post-pandemic, and actually they were the ones that were providing support to people that needed it the most, the people with multiple high levels of disadvantages. So people experiencing racism, with severe mental illness, living on their own, with a significant physical health issue, so maybe in high-risk groups. So those people that get the support from tiny organizations up and down the country, those organizations weren't going to be there. And that literally broke my heart. And I think that led to me having shared conversations with 16 CEOs of mental health charities, my colleagues at the City Mental Health Alliance, like Beth and Nigel, Paddy, and us all reflecting together what we could do. And I guess I found myself in a position where I bridge two communities with the City Mental Health Alliance. Yes, we're a social enterprise and part of the mental health social sector, but we also serve the city, and we've got some very big, generous members amongst our network. So my job, I thought, was to see if I can integrate the two. And that led very quickly to generosity and compassion on both sides to lean in and create the sustainability program. You've heard from Kathy and others earlier on all the things that we've achieved and the private sector partners that have led on this initiative to create what it is. And I am so grateful and so thankful to everyone for leaning in and producing this initiative so that we can support those people that are going to be the most impacted. And if we manage to improve just one person's life and sustain just a handful of medium enterprises, SME charities, then I think we would have done an incredible job and something that we should all be proud of. So thank you very much.
Amongst the many things that we've learned over the last 8 or 9 months is that the COVID-19 pandemic has not affected everyone in the same way. Some communities have shouldered a greater burden and have lost more. And because at Mental Health UK we're passionate that everyone has the chance to live their best possible life, we're really proud to be part of the Mental Health Coalition and to support the Association of Mental Health Providers to take forward the Mental Health Sustainability Plan.
The Mental Health Sustainability Programme is a really powerful example of the collaboration that's come out as a result of COVID. And at Young Minds, we're delighted to be part of the Mental Health Coalition, supporting the brilliant work of the Association of Mental Health Providers to enable this programme to really reach those local community organisations that are absolutely critical at making sure that we have mental health support for all, especially those people through social and economic disadvantage face real mental health inequalities.
This sector is at the very heart of our communities, supporting people during the pandemic and hopefully beyond. But the long-term future is at serious risk, and that's why Rethink Mental Illness is proud to be in the Mental Health Coalition and support the Association of Mental Health Providers in delivering the much-needed Mental Health Sustainability Programme.
It's really great to see the Mental Health Sustainability Programme go from strength to strength. The impact it's going to have on the voluntary sector will be far and wide. It's about sharing skills, developing new relationships, And certainly we imagine that this will continue beyond the lifetime of the programme. So let's watch this space, and the Centre for Mental Health continues to be really pleased and proud to be a partner.
Hello, I'm Paul Farmer, Chief Executive at Mind. 2020 has shown us the importance of working in partnership with public, private and voluntary sector organisations to try to make sure that people can really access the help and support they need for their mental health. And for that reason, Mind is hugely proud to be part of the Mental Health Coalition led by the Association of Mental Health Providers that brings together the ability of expertise through the donation of minutes to support smaller mental health or voluntary organisations and community organisations. It's a great initiative. We're really proud to be part of it.
We are so grateful for all those who've participated and taken time from their busy schedules and given so much to the programme. Finally, a word from our CEO, Kathy Roberts, who is also a member of the programme's governing body, whose expertise has guided and continues to guide us in implementing this pioneering programme. Kathy, over to you.
My name's Kathy Roberts. I'm the Chief Executive of the Association of Mental Health Providers. I'm proud to be delivering this programme. Thanks to all our private sector partners who have shared their valuable insights and reasons to being part of this programme. And thank you for the provider sector who has shared their powerful stories with us today and their experiences over the last 8 to 9 months delivering essential support to those who need it most. And how as providers they have benefited from being part of the programme so far has been really helpful. We hope we have managed to convey the difficult times provider sectors and the communities they support are experiencing now and will be facing going forward, and how much we need your help to deliver the support to them. We know the pandemic has disproportionately affected so many communities, particularly Black, Asian and minority ethnic communities, and the local organisations who support them. And that these communities have often experienced the greatest health inequalities, and this has significantly worsened over the last year, and the impact has been felt by many. This programme offers providers support, not just in the short term, but also in the medium and longer term. Supporting a sector to be sustainable is absolutely essential. And this programme is so exciting as it offers minutes, focused volunteer work, small grants, knowledge and resource sharing, advice and peer support networks, just to mention a few. This programme also shows how working in partnership gives an opportunity to do things differently. Partnership with the community, partnership with providers, partnership with coalition partners, and important partnerships with the private sector. I want to take the opportunity to give a huge thanks, particularly to all our valued private sector partners, without whom we could not be able to deliver this programme, and to Nigel Jones, who's been an absolutely excellent chair. I'd like to thank Goldman Sachs, who have made this entire multifaceted programme possible, to the several organisations who've given financial contributions, and Linklaters for generous contribution on this comment of Caitlin for 1 year, to Bupa for their branding support and volunteering minutes donated to the providers so far, to Hogan Lovells for their support with legal advice and guidance, to PwC for their support to date with providers, and to Slaughter and May for their knowledge and resource sharing, to KPMG, Deloitte and Salesforce for their engagement to date. This collaboration can really support the sector going forward, and we would really like more partners to join us. Whether you want to contribute money or minutes, we would really like to work with you on this essential partnership. We would like to see many more partners join the programme, so please contact us with any questions or if you're interested, and please do share with anybody in the network who you think might like to join us and will be interested in continuing to develop this programme. Thank you for joining us today, and take care.